it can be congenital, it can be traumatic, inflammatory, neoplastic, or miscellaneous. Remember, unless and until we take a proper history, we will be unable to diagnose this condition. So, to diagnose or to come to a conclusion, we need to take a proper history. To this channel, myself, Dr. T. N. Devnath, Doctor of Modern Medical Science, motivational speaker, and life coach. In this video, I will talk about one of the important topic that is called examination of swelling. If you are an MBBS student and you are posted in the surgery department, remember, examination and history taking for the swelling is very important. So let us start with the swelling. Swelling, we already know, swelling is enlargement or protuberance in the body, right? So any kind of swelling we have to examine under the four heading of inspection, palpation, percussion, and auscultation, right? Now, inspection is observation, how you can see, and palpation is how you feel, and we will details discuss later on. Now, let me talk about this swelling. Now, swelling, it can be congenital, it can be traumatic, inflammatory, neoplastic, or miscellaneous. Remember, unless and until we take a proper history, we will be unable to diagnose this condition. So, to diagnose or to come to a conclusion, we need to take a proper history for the swelling. So, in this video, let us take a proper history for the swelling, right? In swelling, first we will ask the duration, whether it is present since birth or not. If it is present since birth, that means that is a congenital condition, and two important congenital condition is the cystic hygroma and meningocele. We already know that cystic hygroma is the swelling near the neck and meningocele near the spinal cord, right? Now, if the swelling is of short duration as well as the painful, the first and most common condition, it will be acute condition, and it will be inflammatory condition, right? And it can be neoplastic, which is of malignant variant. That means that is cancerous. It will be short duration as well as the painful. But if it is long duration and there is no pain, that means it is a chronic condition and it is probably a benign condition, right? But if it is long duration with mild pain, then it is chronic inflammatory condition. We need to understand this. One important question you should ask, that patient should know the difference between the appearance of the lump and the first notice of the lump. That means the lump may be it is there for long time, but he or she has noticed for 1 week or 2 weeks. So it will be basic difference. You have to ask when she noticed or he noticed the lump and when it appeared actually. So you have to take care of this important point. And number two, mode of onset, how it often occur. Like it may often occur after the trauma, so it will be a traumatic like hematoma. If you have a trauma like RTA or any kind of road traffic accident, so you have knee injury and there will be hematoma. So if there is swelling, we have to take the history of the trauma, right? If it is gradual onset, that means benign. If it is from pre-existing condition, remember two important condition. One is keloid. Keloid is actually occurs from the pre-existing condition like burn, scar, right? Malignant melanoma, one of the skin condition, you will come to know in later on, that is actually come from benign nevus. These two important you should know actually at this moment. Okay, now third important point is the associated symptoms you have to ask, and most important associated symptoms is the pain and difficulty of the swelling or swallowing or respiration. Like in case of thyroid swelling, if there is thyroid swelling, it may give pressure on the breathing tube, or it may pressure on the esophagus. So there might be some problem with the swallowing and as well as the respiration. You have to ask this question specifically in case of if you are examining thyroid swelling, and if the case comes out to be an anaplastic thyroid carcinoma, which is a very malignant type of carcinoma, and usually patient present with this kind of problem with the swallowing as well as the respiration with the thyroid swelling or the swelling on the neck. So you have to ask this question specifically, and remember you have to mention or you have to ask the associated symptoms specifically. Unless and until you ask this question, many of the patient may not tell you that he or she has other problem also. So you have to always ask. Now one important question is, pain is good or bad? It is good or bad, right? Pain is always a symptoms, and it is a good symptoms because it will give you indication that something is going wrong inside in your body. So you have to give good importance to the pain. If there is no pain, so gradually you will damage the organ, and at the last moment there will be nothing to do, right? Like in case of, you already know that kidney, in case of kidney problem, no, you might not have any symptoms and all, and ultimately when you come to know that you have a kidney problem, and it will be in the last stage. So definitely pain is a very good symptoms. We have to we should thankful to our pain, because it gives our opportunity to work faster and to get cured earlier. Now, nature of the pain is very important. It may be throbbing pain. Throbbing pain means there is inflammation and infection, and there is pus formation. Remember, there is pus formation, so there will be throbbing type of pain. In case of stabbing pain, what is stabbing pain? Stabbing pain, just like it is a sharp or sudden onset pain, severe pain for short duration pain. It is stabbing type of pain. In case of like pancreatitis, you can see renal colic, you can see acute cholecystitis, acute appendicitis. These are the conditions where you will get a sharp pain, actually, a stabbing pain. And there might be some other type of pain also. Pain timing is important. Whether pain come first, then the swelling, then it is inflammatory. If swelling come first, then gradually there is pain, so it will be a neoplastic condition, except osteosarcoma. Osteosarcoma is a bone condition, is a bone malignancy. Okay, pain due to involvement of nerves or deep infiltration. This is, you have to know why there is pain. Pain because of involvement of the nerves or deep infiltration, ulceration, fungation, or any inflammation. That's actually indicate the inoperability of this condition, and it actually give the important clue to the surgeon that the disease is very severe or not, and the staging of the disease also sometime. Now, pain site is important, where it is occurring. We know there is a referred pain in case of appendicitis, actually periumbilical pain, which shift to the McBurney spine later on, right? So this is the importance of referred pain. There are other referred pain also, we have to know. And number 4, progression of the swelling. It is slow growing or fast growing, any associated fever, other swelling or lump inside the body. Now remember, in case of any one swelling, there might be some other swelling inside the body also. So you have to ask the question, because in case of multiple swelling, we see in case of neurofibromatosis or Hodgkin lymphoma. If there is Hodgkin lymphoma, there will be other lymph node swelling. So you have to ask this question specifically, because if it is a single lump, it can be dermoid, it can be sebaceous cyst, or it can be other things also. But in case of neurofibromatosis, there will be multiple swelling inside the body. So this is important. Any secondary changes you have to look, or you have to see, or you have to ask, like ulceration or fungation, impairment of function. In case of limb, like if you have injury to your limb, so is there any impairment in your function? So it indicates the severity of the disease. Recurrence of the swelling, like fibroid, and it will recur again and again. And cystic swelling, in case of cystic swelling, if you don't remove the cyst wall, it will come again and again. Loss of body weight, yes, if it is loss of body weight, then it is always an indicate of malignancy, that what we call it as a cachexia. Any past history, personal history, you have to ask. In case of like betel nut or tobacco, kheni, you have to ask this personal history and family history also. Now examination, we will talk about in the next video. Stay tuned, and if you are new to the channel, subscribe the channel. Thank you so much.